The human brain is one of the most complex structures known to man. Intricate networks of brain cells woven carefully between blood vessels and neural signals, operating in a delicate harmony that keeps us ticking every day without any thought about it. Dementia is a progressive and incurable collection of disorders affecting the brain, impacting 459,000 people in Australia. The various symptoms of dementia result in challenges that include aggression and anxiety, impacting individuals and their carers. These symptoms are often treated through the use of restraints and sedation. However, the 2018 Royal Commission into Aged Care found that only 1 in 10 patients benefit from this sedation, with many suffering from major side effects from taking these drugs. The importance of alternative, non-medication-based therapies, such as access to sensory blankets, is clear. 1 in 10 Australians over the age of 65 are estimated to have dementia, with 250 people diagnosed every day. This number is set to increase to 318 by 2025 and 650 per day by 2056. These numbers may seem overwhelming, and it can be hard to remember that you and people you love could be the ones affected.
Research, however, has shown that sensory stimulation can reduce the escalation of behavioural symptoms, such as aggression and anxiety, and improve overall patient well-being. Symptoms like these would otherwise be treated with medication restraint, which in many cases is not beneficial and has negative side effects for the patients. That's where Sensed comes in. Throughout our needs analysis, we spoke to allied health and nursing staff at a local hospital. We learnt about the lack of appropriate activities for people living with dementia and the difficulties these patients may face, including both delirium and falls. Staff had to resort to handing out inflated rubber gloves to patients to provide distraction and engagement. Sense saw the opportunity to provide relief and set out to increase the accessibility of sensory blankets for dementia patients. These cost up to $100 a piece at retail price, leaving hospitals unable to afford them. They provide not only a tactile experience, but a point of shared communication between healthcare staff and individuals living with dementia, allowing for a greater focus on person-centred care. Thus, we worked with our local hospital, conducting a collaborative needs analysis, landing on a shared vision with 2 key elements. Firstly, improving patient well-being through the provision and support of sensory products. And secondly, fostering long-lasting and sustainable connections between stakeholders, tackling the stigma surrounding dementia. According to ABS data, Australians waste over 500,000 tonnes of textiles every year. Sense saw the opportunity to take these materials and upcycle them into a sensory product that could help those living with dementia.
Our business model is as follows. Initially, textiles, fabrics, and attachments are donated at any of our collection points. These donations are then sorted and passed on to our partner schools. Here, students create the blankets using squares of fabric from different textures, with attachments such as buckles, zips, and pockets that will stimulate the senses of the individual user. Finally, the blankets are donated to hospitals and to people living with dementia. Staff at our partner hospital are educated on how to use the blankets as part of a person-centred approach, reflecting an improvement in care that can be provided. To maximise our impact, we work with local schools. Sensed allows students to personally create sensory blankets within existing class time. This is closely aligned with the existing National Home Economics School curriculum and also doubles as a co-curricular activity. These blankets conform to the clinical guidelines and standards of the health groups and are fully upcycled from the collected fabrics. Sensed shows how an entrepreneurial approach can bring together groups and realise social change, supporting improved quality of care, addressing intergenerational social stigma, and promoting environmental sustainability. We have donated over 150 blankets since August last year and have received positive feedback from students and teachers, with all schools having permanently included the program in their curriculum. This year, we have grown our schools program by working with the National Home Economics Teachers Association. After presenting at a state conference, our project was shared to teachers nationally, with 10 schools wanting to sign up in 3 days. Pre-COVID-19, we had doubled the schools we work with, working with 10 schools in WA, including 2 in regional WA. We are also piloting our program with a South Australian high school. We have developed a new partnership with a state quilting association, where we have established a volunteer program for members to create quilts and donate them to Sensed. We have received great feedback and will be working to ensure this is a long-term relationship. The project's growth has led to increased public recognition. We placed first in the Perth Soup Microfinance pitch event, have been featured in a local newspaper with 80,000 readers, and were invited to co-present at a Healthcare Excellence Symposium later this year. And most notably, we featured on Channel 7 in January 2020. This recognises the innovative nature and direct social impact that Sensed is having on the community.
They're not doctors or researchers, but high schoolers learning to sew to support people with dementia. These students are making sensory blankets with zips, buttons and different textures. They're designed to comfort, but also to trigger memory for people who forget.
Often the person's actually in a very sensory deprived environment. People with dementia are no different to people without dementia. So we as human beings need sensory input. We're programmed to have it. So when we don't have it, something feels wrong.
If the sensory input is similar to what a person experienced in their past, it might trigger a memory.
If they have lace on or wool, that might take them back to their childhood, which may prompt a memory, which may mean they might, recall the names of their families.
Research has also shown the other potential benefits of busy blankets or fidget blankets.
Decreasing agitation, decreasing pharmacological intervention, falls, reducing the risk of pressure injuries.
One of the community groups that Sensed has partnered with to make the blankets is the WA Quilters Association.
Why are we involved with dementia? Because quite a few of our members have dementia. Our group goes up to 90-year-olds.
And welcome to The Virus, our Sunday night.
Because this is going to be transformative.
Number 2, avoid touching your eyes, nose and mouth, because that's the way the virus could get into your body.
Medical staff are working around the clock.
Moving forward, COVID-19 has presented significant challenges for Sensed. Prior to the impact of COVID-19, Sensed organised to work with over 250 students between years 8 and 11. School closures, changing hospital priorities, and a hiatus in many volunteer groups have presented complex challenges. However, we continue to grow and develop during this difficult time. Sensed is measuring impact using a formal quality improvement program at a local hospital. We have received positive feedback across nursing and allied health staff members on the benefit of blankets for patient care. Formal results from pre and post surveys have been delayed due to focus on COVID-19, however we are continuing to closely monitor our progress.
Nevertheless, we continue to be in regular contact with high schools and will be scaling up our return to classrooms as schools resume a normal structure, and likewise with community groups. We're also in the early stages of an additional needs analysis for an online platform to facilitate the creation, collection and donation of sensory products to our healthcare system. This is with the intention of increasing sense accessibility, efficiency and most importantly sustainability, with the goal of supporting schools, community groups and healthcare professionals to use our resources to take ownership of this project in their own communities. Secondly, we also plan to expand our offering beyond blankets. Based on hospital feedback, we will investigate and trial sensory distraction boxes that contain a range of age-appropriate sensory activities that can be given out and reused by multiple patients. The aim of this is to provide an increased variety of activities that will benefit more patients and increase the ease of which these activities can be accessed by those patients. Through the provision of over 150 sensory blankets in the past year, we are working towards UN Goal 3 of good health and well-being. And through our textile recycling programs, Sense has reduced textile wastage by approximately 70 kilograms in this year alone, servicing UN Goal 12 of sustainable production and consumption of materials.
Having worked and interacted with people living with dementia, as well as their close family and friends, it is so apparent that innovative products like sensory blankets are so important and are such an underrated help for the many complications that can arise with day-to-day life. I really believe that sensory blankets have transformed our treatment and care of dementia by focusing on the individual and actually trying to improve their quality of life, as opposed to just attempting to reduce or restrain their symptoms. Simply expecting an expansion of the healthcare system is not really a feasible solution, and I really think that we need to be looking towards solutions such as these, solutions that can be incorporated into a more community-based, healthy lifestyle, instead of confining people to a life within the four walls of a hospital room. Dementia is definitely going to continue to present significant health and social challenges for years to come. And with increasing pressures on health systems globally, the way that we approach healthcare needs to be integrated with our communities in new and innovative ways for the benefit of everyone.
Sensed is uniquely holistic, offering a direct response to healthcare communities, education, and a waste-free solution in just one blanket.